to offer today is we received, or I at least received, a copy of the audit of the ME's office, and most of you probably received it. And I wanted to give us an opportunity to review it and then maybe have Marcy say a few words at our next meeting. That way we all have an opportunity to kind of dive into it. And that would be.
Madam Chair,
Yes.
if I may,
Sure.
that audit's going to be on the audit committee agenda at 9:30 tomorrow morning for discussion. So anybody that's not on audit that has an interest, 9:30 tomorrow morning, audit committee.
Right. Thank you, Mr. Vice Chair. All right, next item, please.
C, approval of the June 28th, 2022 meeting minutes.
Is there a motion?
Approval, Madam Chair.
It's been moved and supported. All those in favor, say aye. Any opposed? Any abstentions? All right, motion passed. Next item.
D, unfinished business. There is none listed.
Next item, please.
Item 1, under new business, requesting commission approval of amendment 2 to a one-year fiscal year 2022 local health department comprehensive grant agreement with the Michigan Department of Health and Human Services.
Right. Are there any questions from the committee on this item? Any questions? Pretty straightforward. Next item. We'll just vote on these two items. You know what? We'll do it separately. All right. Is there a motion for approval of?
Move to approve.
It's been moved and supported. All those in favor, roll call vote.
Commissioner Marecki, Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Motion passed. Any abstentions? All right. Next item.
Item 2, requesting commission approval of a contract with the Wayne County Conservation District.
All right. Are there any questions? Commissioners? All right. Commissioner Dodd.
Thank you, Madam Chair. I'm just wondering if anyone is here from the Wayne County Conservation District to give us some information on exactly what they will be doing with this program and what they will be testing. And sorry, I'm a little flustered here. My email was giving me some trouble, so I'm working with a paper agenda. What they will be testing and just any other information on this program. I don't know if anyone's
right.
on from.
Do we have, you can come on up to the mic. Please introduce yourself for the record.
My name is Dr. Connie Boris, and I serve as the Executive Director of the Wayne County Conservation District. And we're not going to actually be doing the sampling of the PFAS, but one of the big complaints Eagle has about Wayne County is that, and this is their words, not mine, is that I am the only one checking about PFAS sites in Wayne County. Nobody else in Wayne County seems to check the governor's, they call it the Michigan Citizen Advisory Work Group. We serve on several committees, and one of them is we need to tell people in plain language what the PFAS is, how it concentrates in your body, how you can be exposed to it. And we would do that in 3 different webinars or workshops around the county. So we can hit 3 different spots. One of the things we got to teach people is, hey, we are the largest county. We have the most people and we have the most PFAS sites. So you need to get educated, because if you're out there on the Detroit River or the Lower Rouge River, you're going to be getting fish that are full of PFOS, PFOS. And those concentrations really bioaccumulate in your body. It'll affect things like fertility, your thyroid. You're going to have a lot of health impacts. Health impacts in the United States alone for PFAS is something like 63 billion. Okay, so our point is, let's educate the people in everyday language. Here's what PFAS is. Here's how you can prevent it. And there isn't anything, and here's the sources. And people haven't put together yet a preventative measures that we need to look at. This is all in the developing stage. So that's what we want to get across to people, just education, and here's how to prevent it so you save your children.
And do you have the dates and locations of your educational events already planned out?
Not yet.
Okay.
Not yet, but we're going to do this similar to something what we've done before. Wayne County Conservation District did some for urban soil surveys. And so we hit like Trenton, and then we hit the Livonia area, and then we hit the Grosse Pointe area. So we could kind of get the county in 3 different areas, spread it around. I'd like to apply the same approach, because we've got all the email contact information for municipalities to get the word out to the citizens. We've already got that database, so I want to make use of that for these 3 different areas of Wayne County. And one of the biggest areas is like the Dearborn area, because it has so much, plating, heavy industry, surfactants, food packaging, landfills. We got it all in Wayne County.
Great, thank you very much. One further thing, Madam Chair, is I would request that the administration, the Department of Health, Human and Veteran Services, keep all the commissioners updated on when and where the educational events will be happening, so that we can get the word out to our constituents.
Yes.
Thank you.
And can we, can you send that information, excuse me, directly to us? I don't know if that would be through the director, or who that would come through.
Through the chair, I'll work with Ms. Jordan, the director of the department, to collect that information and make sure it gets to the commissioners.
And also any marketing materials that you may already have on PFAS?
As they compile that, we'll make sure that whatever they develop and create will be shared.
Great.
Thank you.
Thank you. All right. Are there any other questions? Vice Chair Colleen? Yes.
Thank you, Madam Chair. And I just want to check with Ms. Boris one more time on the locations. I think you commented you don't have them yet. Are you going to be able to get from Eagle, from the state of Michigan, the areas in Wayne County that have a high concentration of PFAS, so that we can alert citizens if these locations are in their area?
We don't have, that's one of the big issues, which is why the Wayne County Conservation District is hitting Eagle. When you go on their website, their PFAS concentrations on sites goes back to 2019. I've raised it over and over again. You need to get these updated. And that's what we're really going to be working on. But the places like Dearborn, where you had PFAS foam coming up from Marathon Oil and going right across Schaefer Road, that is now a PFAS site. We've got the sites that there are, but this is preliminary. I mean, there's going to be a lot more sites in Wayne County than what we've got now.
Thank you.
Thank you. Any other commissioners? All
Move for
right.
approval.
Their support.
Support.
It's been moved
I'll
and
third.
supported. Let's have a roll call vote, please.
Commissioner Marecki? Commissioner Dobb?
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen.
Aye.
Chair Baker McCormick.
Yes. Motion passed. Next item.
Item 3, a report from Alita Jordan, Director, Department of Health, Human and Veteran Services on the Wayne County Medical Marijuana Safety Campaign.
Good afternoon.
Good
My name is Melita Jordan, and I'm the Director for the Department of Health, Human and Veteran Services. I actually am going to turn this over to Dr. Seth to present the information on the COVID, and I believe the other one is for the Wayne County Medical Marijuana, and Dr. Jennifer Floyd will present that information for you. Thank you.
Thank you. Okay, she's on Zoom. Okay.
I don't see her in this waiting room. I've been looking out for her, but I don't see her name.
Okay, will we want to have Ms. Floyd? We can go to the other, or I'm sorry, Ms. Dr. Seth, did you want to present first while we wait? We could do it that way.
Okay, and I have slides as well that were submitted earlier.
Okay. Clerk is pulling them up. So.
Yes, that's it. Thank you. Thank you, Chair Baker McCormick, for this opportunity to provide the COVID-19 update to this audience. And we are also going to provide a brief overview on monkeypox virus as
Okay.
well.
Can you give your name and title for the record? Thank
Sure.
you.
Avni Sheth, the Division Director for Public Health and the Medical Health Officer for Public Health.
Thank you.
You can go to the next slide. Thank you. So I'm going to start with just providing an overview of where we're at with the COVID-19 pandemic at the moment with the data. And so with our most recent reporting period, July 27 through August 2nd, we are currently in an uptick of cases. As you all are aware of, we've had 2,657 new cases reported and an average number of new cases per day at 377. This is a 12% increase from the prior week and a 10% increase from the 2-week period prior. And you'll see our cumulative totals there were for Wayne County. This is data specific to Wayne County. Our cumulative total cases are at 309,000 and our deaths are at 4,558. Next, please. This is our trend map that really takes a look back to the beginning of the pandemic in 2020, which is on the left side, and where we're at right now. And these are our cases per day. This is a nice trend curve that highlights all the different waves that we've experienced in these over 2 years that we've been in this pandemic. And you can see that on the right side, we are currently in an uptick right now. The January, the big peak that you see right there, that's that January initial Omicron surge where we saw a rapid rise of cases. Next, please. Our positivity rate for Wayne County is at 20.9% of tests that are returning back positive. And you can see that's the column most to the left for Wayne County, and you can see there's been a steady uptick in our positivity rate. Next, please. And following that is our case rate, which is our number of weekly cases per 100,000, which have also steadily increased in the weeks period prior. And so our case rate for Wayne County is at 247, which is a 12% increase from the week prior. And so this is our COVID-19 community level. You all may have heard of this tool that CDC put out to help communities really monitor the level of community transmission and to implement and take on whatever public health measures and precautions depending on the community level at that moment. And so for community level, we include Detroit in our Wayne County community level. So for all of Wayne County, we are at a high community level currently, with our case rate being at 230 new cases per 100,000. Our hospitalization rate on the bottom there, you see at 11.1 new COVID-19 admissions per 100,000, which is an increase of 6% from the previous week. And our hospital occupancy rate, so these are the beds, inpatient beds that are specifically occupied by patients with COVID-19, is at 4.2%. So these measures, these are the three measures that we look at to place communities at different levels. And so the majority of counties in Southeast Michigan right now are classified as high. At this high community level, the recommended actions you see at the top there, at the high level, it is a recommendation to wear a mask in indoor public settings. And then of course, at all community levels, we are still continuing to encourage all of the preventive measures that we know that work. First and foremost being staying up to date with your COVID-19 vaccinations and boosters, getting tested if you have symptoms or an exposure, and talking to a healthcare provider about treatment options that are available right now. Go to the next slide, please. And so the main driver with our current uptick in cases is this BA.5 variant that is circulating right now. And as of July 30th, in the US, per the CDC variant tracker, this is the dominant variant, which is a subvariant of the initial Omicron. BA.5 makes up 85.5% of all COVID-19 cases. So you can see that it has taken over as the predominant subvariant of Omicron. BA.4 is at 7.7%, and our BA.2.12.1, which I feel like we were just talking about, is already down to about only 2.1%. And so with each new variant, what we're seeing is a growth advantage with each variant, especially of the Omicron sublineage. And so with BA.5, it is shown to be more transmissible, and that's why we're seeing the increase in cases. We're monitoring this closely. We have not seen direct evidence that it's causing more severe disease, so that is reassuring. So we're not seeing though we're seeing an increase in hospitalizations, not nearly as much as we've seen in the past. And we are seeing the impact and the protection that our vaccinations and boosters continue to provide with each variant in severe disease and death. This is a nice trend map of our hospitalization data that I wanted to show everybody. And so this shows what is happening to our hospitalization rate since the beginning of the COVID-19 pandemic, and what the impact of each of our variants and the waves that they've resulted in, and what is happening to our hospitalization data. And so it's somewhat of a busy graph, but each line is a different age group. So you can see each age group is kind of following a similar pattern. And what we've seen is that with each surge, obviously our hospitalization admissions due to COVID-19 increases with each surge. However, so way on the left is since the beginning of the pandemic, and on the right is where we're at right now. You can see that our hospitalization admissions are increasing, but to a much lesser degree than what we've seen with prior surges. And I have the slide afterwards also demonstrates what we're seeing even within hospitalizations and the severity of hospitalizations. And so with all these various waves that we've seen, and again, on the left side is kind of towards the 2020 period of our pandemic, and on the right side is more closer to where we're at right now. The gray line on the graph is our hospitalizations, and this is for this is what we're seeing in general in Michigan. And so the gray line is our hospitalizations. And so you see which with each of our waves and our variants, the hospitalizations have increased. However, the bottom two lines, the blue lines are hospitalizations that required an ICU stay and our hospitalizations that required somebody to be on a ventilator. You can see towards the right, you see as we see that hospitalization gray line increase, we see those blue lines kind of really staying steady. So that is reassuring data of the severity of how sick people are getting and really the impact of our vaccinations, the profound impact our vaccinations have had and the treatments have had. And we've come a long way since the beginning of this pandemic on keeping people more safe. You can go to the next slide. This is another slide that demonstrates what we're seeing with our vaccination data and our hospitalization. And this is Michigan data. So I like to show this data specifically. And it's fairly recent data from May where we're seeing what the risk, depending on vaccination status, is when somebody gets infected with COVID-19. And so we see the unvaccinated have a 20 times risk of dying compared to those that are up to date with vaccination. This is CDC data, so this is nationwide data that is specific to the second booster that also demonstrates a similar message here. We saw in those that were 50 and older in April 2022 that those that have received that second booster had a lower risk of dying than those that received even one booster or were unvaccinated. And so here is kind of our approach and our framework to COVID-19 now that we're 2 years in a pandemic where we have a lot of the tools we know that work and that keep people safe, easily accessible. MDHHS, who we align closely with guidelines and public health recommendations, have put out this framework of how do we respond to COVID-19 moving forward as we learn to live with COVID-19 and live through it as it ebbs and flows. And we see these waves and we come down from these waves. And so this COVID-19 cycle really outlines how we dial up and dial down our response and our actions based on where we're at in the moment. You can go to the next slide. This outlines, our main buckets, our categories. We talk about a lot, we message about a lot, and all the tools that we have easily available right now with vaccinations, tests, reaching for masks and high quality masks in the appropriate setting, and treatment options, and specifically treatment options now that people can take when they're not in the hospital to prevent them from getting into the hospital. So all of these tools that we have as we deal with the ebbs and flows of COVID-19. And so I wanted to shift gears and outline and give an overview of our COVID-19 response from the Wayne County Public Health Department and all the tremendous work that our public health team has been doing for 2+ years into the pandemic and where we're at right now, and reaching and trying to provide all of these tools to the 42 communities that we serve. You can see here, this is our main landing page, waynecounty.com. Right on the top is our information for communities to access right away vaccination and testing sites in their communities. That's our phone number that we have. We answer every day to answer questions, point people towards vaccination sites, treatment sites, and answer any just general questions people have. You can go to the next slide. This is on the left side. We had a really great communications campaign that was really trying to drive people to get their vaccinations, get up to date with their vaccinations, get tested, so that you see that on the left side, that some of those communication materials that were put out there. And on the right side is our current map of our vaccine and testing locations, providing access across our geography to individuals for vaccinations and testing. We have 9 sites that are offering vaccination, and 5 of those sites are also doing testing. We're doing vaccinations for 6 months and up, all the boosters, all the different types. Testing is no cost. So these are really accessible, no appointment required. People can just walk in. And this is, our vaccination data, which I'm very proud of where we're at in Wayne County, though I would love to continue to make progress in these numbers. We do remain higher than the state rates. And so we've achieved that in Wayne County. The 3 columns there show the vaccination rates. On the left side is 12 and older. The middle column is 5 and older. And on the right side, you see 6 months and older. And so we're at 72.7% of our 12 and older population in Wayne County that have received their primary series. The 5 and older is at 68.7% and 6 months and older is at 64.4%. In addition, I wanted to display some of our cumulative vaccination response since we've had these vaccines available. We've administered a total of over 204,000 vaccinations. We've redistributed, meaning given to local providers, over 280,000 vaccinations for them to provide in their clinics and in their community settings. We do also do a tremendous amount of outreach into schools and our various community settings and respond with vaccine clinics. We've done 173 in-school vaccine clinics that have been very successful in reaching our children with accessible vaccinations. We've held 79 community clinics, and most of these community clinics are focused on settings that we see a lot of seniors. So the long-term care facilities, the nursing homes, the senior centers, the group homes. We also provide those in-home vaccination for our homebound residents, oftentimes who are seniors as well. And we're doing, you call us, you let us know if you want a vaccine clinic, we're there for you. So we've supported lots of community organizations and health fairs at various community events, churches, because really we're trying to get people, push this out in the community and make it really accessible. We also have a great partnership right now with our jail team and supporting them in making vaccinations more accessible there. So we have a team that goes out weekly and provides vaccination to those individuals as well. And we continue to provide the in-home doses as well. This is some of our face mask distribution. This was really important to get out. We've learned a lot about how to keep ourselves safe with COVID-19, and one of them is a high quality mask and making sure everyone has access to that. And so you can see we've distributed over 4 million adult masks out. We've also gotten high quality masks for children out there, and we're just about 500,000 there distributed already, and we continue to do this. The other thing I wanted to highlight is our COVID-19 dashboard, which we've improved and relaunched recently, which provides really great community level data for all our municipalities and our residents out there to see how their community is doing. We showcase the community level when we update that weekly, so everyone kind of sees that. And we have various case data and vaccination data. And some of this data is available at the municipality level, which is nice as well. And so wanted to showcase that. That is off our waynecounty.com/COVID-19. And then there's a link to the dashboard there. Okay, so I thought I would switch gears unless maybe I'll take a pause and see if there's any questions around COVID-19, and then we can switch gears.
Commissioner Marecki. Thank you, Madam Chair. Thank you for the presentation. Excellent slides. They're very readable. I do have to ask though, is there any talk right now going on in Wayne County about making a mask requirement for school-age children? Schools are going to be starting in the next few weeks. And where does that stand?
Yeah, so that's on the top of everyone's mind. And so very good question. We're following the data right now very closely. Right now, we are at a high community level, and at that community level, it is recommended that there's masking indoors. And so much like when we had we were at the high community level most recently, we did issue a recommendation of masking indoors. And so I think it'll be, left to each school and family and community to decide how, what level of implementation they want to do with that. I think from a public health perspective, whenever we are in a high community level, we will make that recommendation.
That would be up to the parents and the children, whether they want to mask.
We are still kind of following the data and seeing where we're at as we get closer to the school year. However, right now, we're at this position where we have all the tools to keep people safe, right? So people have access to masking, testing, vaccination, and we're at the position where we're making recommendations based on the data.
You, Commissioner Dobb.
Thank you, Madam Chair. Oh, gosh. Oh, I almost forgot my question. Will there be a different type of booster available this fall?
Yeah, so-
Rumors.
Yeah, yes. So the FDA did meet and they voted on working on and implementing a fall booster that includes a component of the Omicron variant in it. So they're calling it kind of a bivalent vaccine. When that will be ready and rolled out is to be determined. We're anticipating in the fall, but how earlier in the fall is unclear. The reasoning behind this is that we're seeing, though our vaccines are still offering very good protection against what we worry about most, right? Dying of COVID-19, landing in the hospital with COVID-19. And I'm sure everyone has stories of, I've gotten vaccinated and I've had COVID-19, right? And so the variants, with each variant, they are more and more evasive of our vaccines. So people who are vaccinated are getting COVID-19, though getting much less sick from it. And so we hope with this bivalent vaccine in the fall that we're protecting people even more than we are right now.
Do you have any information on who will be eligible to receive that vaccine?
We are still waiting for kind of the CDC and everyone to weigh in and make that recommendation. It does seem like there's going to be a general adult, at least adult population recommendation. So I know that second booster, there was a specific, 50 and older, or if you were immunocompromised was a second booster recommendation. The information that is being put out right now, it seems to be going in the direction of a general recommendation for adults, but we can't really, we don't have the formal information at this time.
Thank you. Thank you, Madam Chair.
Do any other commissioners on COVID-19? Right, you can proceed.
Okay. So I'm gonna.
Madam Chair, I did have
Sorry.
one quick question. With the increased use of kits that people are purchasing, how reliable are the numbers that we're seeing in what we just seen on the presentation with, since they're not being hospitalized, not getting the test at a facility? And it seems as though it would really create a major problem trying to determine an accurate number of the infection rate.
Yeah, so that's a very good point. We know that on one hand, it is really an amazing tool that empowers the individual in the home to take action immediately, these home kits, and we are actually distributing home kits and trying to make them available to everybody and pointing them to resources for that. We do know that our case data specifically is a significant underestimation because of that. And there's various different, numbers being flown around of how significant of an underestimation it is, but it is safe to say it is a significant underestimation. And so with the increased use of the rapid test kits now in the community, we are really paying attention to our hospitalization data a lot, because I think that really shows us what impact whatever is happening in the community is really happening in terms of severe illness. And so the CDC community level 2 takes into account hospitalization data and occupancy data. As you all may have remembered, in January with the Omicron surge, we were really worried about that, right? Because the cases were just so significant. The hospitalizations also increased. We were really worried about hospital capacity at that time. And so we're really looking at those other measures to see what impact the variant in the community is having on the population.
Last question I have is, could you provide us a list, something that's can be posted that we can share with people on Facebook and other social media as far as the vaccination locations, that are still currently active, that are, and as well as the testing location, the PCR testing.
Yes, absolutely. We'll share that.
Thank you.
Okay, you can go ahead and proceed.
Okay, so we're going to switch gears to monkeypox. And so we are currently responding to an outbreak within a pandemic at the moment. And so I'll be referring to monkeypox as MPV moving forward. So as you all are aware of, there's been a global multi-country outbreak of MPV ongoing since about early May. What's unique about this is that MPV has existed for years and years and years. However, the current outbreak is spreading in countries that normally do not have cases. Currently globally, as of August 4th, there's over 26,000 global cases across 81 countries. The US currently leads as the top country in case count at around 7,999. Go to the next slide, please. I want to point out that the majority of cases, about 60% of cases, are concentrated in these top 5 states, New York, California, Florida, having the majority of cases. And as this MPV has spread and the cases have increased significantly from the administration at the White House, the HHS has declared in the US a public health emergency. And this is mainly to be able to mount a more robust, coordinated response and bring the resources necessary to have control over this outbreak. Go to the next slide, please. And so this is where we're at in the state of Michigan. This is as of August 8th. So this is updated pretty continuously, almost daily. So this is as of August 8th in Michigan, we're at 72 cases. In Wayne County, including Detroit, we're at 25. So the majority of cases are in Wayne County. 17 of those cases are in the city of Detroit, and 8 of them are in out Wayne County. And then you can see the other counties with the top number of cases as well, with Oakland, Macomb leading after the city of Detroit. And so soon after our first out Wayne County case, the Wayne County Health Department did release a public health advisory to increase awareness around the signs and symptoms of MPV, when to seek medical attention, and the treatment and prevention tips and vaccination. We really wanted to get the word out there and to educate our communities. Though I want to emphasize that the risk continues to be low for the general public, and that's mainly because of how it spread. So it does not spread easily between people. This is not COVID-19. And so we wanted to make sure that message is clear. However, it's still important that everyone be aware of symptoms, risk factors, prevention, and when to seek medical attention. So I'm going to provide a brief overview for the audience today around MPV. It is caused by a virus. The symptoms can include a flu-like illness, so fevers, muscle aches, swollen lymph nodes, fatigue, and then the characteristic rash. So some people don't have those flu-like symptoms and they just have the rash. So the characteristic rash can resemble pimples or blisters. It can be anywhere on the body. It goes through these specific stages. The slide before kind of showed some typical lesions that we're seeing right now. It takes about 2 to 4 weeks for the rash to resolve. It can take about 1 to 3 weeks for symptoms to develop after somebody's exposed to somebody with monkeypox, with MPV. It does not spread easily, okay? So it really requires this close, personal, oftentimes skin-to-skin contact, including sexual contact, to really spread. So most commonly what we're seeing right now is that it's spread through the skin-to-skin contact, so that direct contact with infectious rash, scabs, or body fluids, touching items that are contaminated with the virus, so that's mainly like bedding, towels, clothing, and respiratory secretions. So really that respiratory secretions from prolonged face-to-face contact. Most of our initial cases are among persons identifying as men who have sex with men. However, it's important to emphasize that anyone can contract and spread MPV. And so we are really trying to, with our messaging, not stigmatize any one group, but also get resources and education and awareness out to those groups that are most at risk. You can go to the next slide. So reassuringly, what we're seeing with the MPV is that most cases are mild and they resolve without any treatment. There isn't a specific treatment around, for MPV, but we have antivirals that have been used for smallpox that have been shown to be effective for MPV. And so those that are at high risk for severe illness, we do have some medications that they would be eligible for. The other main response and tool we have is vaccination, and this is it's called Jynneos vaccine is what is first line at the moment. And currently, the recommendation is that those that have had a known contact with somebody with MPV get vaccinated, and those who are at higher risk of a recent MPV exposure are currently eligible. We want to really get the limited supply that we have right now in the state of Michigan out to that group that is at highest risk. It's very important that we communicate and we message that anyone experiencing a new or unexplained sore or rash or contact with someone with MPV, really seek medical attention and get an evaluation and get tested. I've outlined some of the prevention steps, and so we're really encouraging people to talk with their partners and talk through any recent symptoms they've had, any rash or spots that they find unusual or that are new. Have those conversations, avoiding skin-to-skin contact or face-to-face contact with anyone who has symptoms. Hand hygiene is very important to limit the spread as well, much like other infectious diseases. So, washing hands with soap and water or alcohol-based hand sanitizer, and then obviously vaccination for those that meet the current eligibility requirement. This just outlines our big buckets of our response that we're doing right now at the health department with MPV. One of the more intensive pieces of this is the case investigation and the contact tracing and monitoring we're doing, which is ongoing. This is a really important tool for us to really stop the transmission. The other thing we're doing is working with our local healthcare providers and systems to help them access treatment for those with MPV that meet the eligibility requirement. Testing is available at our Wayne County Health Department clinic. Testing is available in the community through community providers and urgent care facilities as well. And so we are offering that Monday through Friday at our clinic as well out in Wayne, Michigan. And then the other big effort we have around right now, as hopefully you have all received the communication around, is getting our MPV vaccine, Jynneos, out as quickly as possible to those that are highest risk. And so we have this flyer on this communication image on the right side that we can share with the group here too, to get out to their communities if you haven't received it. But it gives information about the eligibility requirement and where to call to make an appointment. And so we've expanded the vaccine criteria, I think last week, Monday, and we've already administered 105 doses. We've received an increased supply from the state too. And so we're trying to get these doses out into those that are eligible as quickly as possible. And that's all I have.
Well, thank you for that, or for both reports. It was very informative. The only question I have is, did you, or just to clarify, the location of the MPV vaccine, it's only one location? Is that what I heard?
Yes, currently we are only, the health department is offering it through our main clinic site in Wayne, Michigan, 33030 Van Born Road in Wayne, Michigan. We are working with a couple partners who see a significant portion of this population that is eligible to really get more vaccine out. But that's limited partners that we're working with right now. Mm-hmm.
Yes, Commissioner Dobb.
Thank you, Madam Chair. And I guess to that point, is there any plans as more vaccines become available to use our COVID-19 vaccination sites as a vaccination sites for the MPV as well?
I think that's a good thought to think through as we kind of expand the response. So I think our response is going to be evolving as we get more resources from the state and more supply, and more access points is always a good thing for people to access. We are noticing that our communication channels are working. People are getting the message of where they can get vaccine, and we have a phone number that people can call that we're answering every day. So I am reassured by our communication channels right now and getting to the right community. But as this outbreak and response evolves, we will evolve with it.
Thank you. Thank you, Madam Chair.
Thank you. Any other commissioners? All right, well, thank you again for
Thank
your
you.
report today.
Thank you.
Thank you. All right, we will move to the next item.
I believe Jennifer Floyd is on the line now for her presentation.
Okay, great.
Yes,
Thank you, Ms. Floyd. Can you introduce yourself for the record?
yes, my name is Jennifer Floyd. I'm the Deputy Director of the Public Health Division.
Thank you.
Thank you for having me. So do I share my screen now?
Yes.
Okay, so our division was asked to present about our medical marijuana media outreach campaign. So because the grant just started a few years ago, this information is 2019 to 2021. We have not collected all the data for this year. That's done at the conclusion of the performance period, which ends in September. So the goals of the medical marijuana outreach campaign are to decrease the incidence of driving under the influence, use amongst pregnant women, and to decrease accidental edible marijuana ingestion by children. So in order to do that, we drive medical marijuana users to a website to learn more about the hazards of medical marijuana. And I emphasize medical marijuana as opposed to recreational, because one of the grant requirements is to focus on just medical and not to comment on or educate on recreational marijuana. So you'll hear me using that term pretty frequently in the course of this presentation, and that is why. So a major part of the campaign includes cable commercials, and at the conclusion of this presentation, I will show an actual commercial. So you can see the name of the campaign is called Blunt Facts. We were very proud of that name. We thought that was rather cute. So it's called Blunt Facts, and every year we do additional commercials, different racial makeup, different gender of individuals in the commercials. So we're really proud of just building upon this program every year. As you can see, the focus again is pregnancy, driving, even safe storage, which also is an issue with people who use marijuana. So as you can see here, there have been over 3.3 million views on cable of these commercials. Some of you may recognize these. I've seen them certainly on TV. And we're very proud of our completion rate, even on connected TV and online, that people actually watch the entire video versus when you see videos on YouTube and you click skip ad or you just click out of it, there's a really high completion rate. The benchmark was 78% approximately. Ours are 95% approximately of completion rates. We're very, very proud of that. So that's over 5.8 million complete views and 6.1 impressions. So those are people who may have watched it but didn't watch the entire video. And also, just as I referenced, we have these same videos on YouTube, again, with very impressive completion rates. We do find that the completion rates are better for the shorter videos, the 15-second versus the 30-second videos, which is to be expected. We utilize Pandora and SoundCloud, which are very, very popular streaming services. In the future, we're going to use a few more, but those are just the more popular streaming services that we started with in the past few years. So on Pandora alone, over 4.2 million views. On SoundCloud, not as many, 3.9 million plus views. And a lot of these streaming services, it's the same commercial you see, but just the audio in some cases. And also, as we know, podcasting is becoming a lot more popular. So within the last year, we did dig into advertising on popular podcasts, particularly podcasts that are shown to be popular within Wayne County. And a lot of our focus groups or focus audiences, I would say, are individuals 55 and older, women 18 to 34, and individuals 13 to 20. Although medical marijuana is for 18 and older, we do see the value in educating people who are even younger because the safe storage piece is critical, as well as the pregnancy piece. Okay. So as you know, when you go on Google and you search for something, that data is captured when you search for something. So we were able to do some reverse data mining to find the most popular words that eventually lead people to our website. So we found the top 5 keywords. Obviously, marijuana was huge, plus weed, plus marijuana and weed and medical marijuana and edibles is showing to be increasingly more popular. Edibles. And our click-through rate is 6.18% when the benchmark is 3.8. So we're seeing a relatively high, almost double click-through rate for people who are searching for these 5 words and other words as well that lead them to our site. So that's a total of over 3,000 clicks, which is quite a bit for something that's non-commercial. And of course, social media, we haven't forgot about that. Facebook and Instagram, which are one of the more popular social media platforms at this point in time. And also we do plan on exploring more social media platforms in the next year because we know different populations tend to gravitate towards different social media. And these are just some stats on the number of people who click on social media. And it's those ads that are on the right side and sometimes on the left side, depending on which social media screen you're on. So these are the impressions and clicks, people who make it to our Wayne County X website. So we're very proud of that. At gas stations and convenience stores. So a lot of you probably have seen, I've certainly seen it a number of times when you're sitting at the pump, upset you're paying all this money for gas and you hear this commercial. And so we're really proud of that. The gas station commercials, which we've added recently, have become very popular. We've had over 42 million impressions and views. So very, very proud of that. And also the outdoor piece. So when you see total impressions over 42 million, that is based on the traffic data of individuals on those freeways, and it's based on assuming one person is in the car. So we know that although we have total impressions over 42 million, even more people are saying that because obviously a lot of those cars do have passengers in those vehicles. This is a high-level map of the billboard locations in Wayne County. And so far, we've had 20 billboards. We will continue to have more in strategic locations throughout the county. And I'm going to show the video now. Okay, which is brought to my attention that you all did not hear the sound. And I'm not sure why. During the dry run, it did work. So I apologize, but you did get to see the closed caption at the bottom.
Yes, we did.
Okay, I'm sorry for that.
That was sufficient. Thank you so much for that presentation, Ms. Floyd. The only question I have is there a reason why we only concentrate on medical marijuana when there's the ability to purchase for general purposes, I guess, non-medical reasons?
Yes, because this grant comes from Laura, who licenses dispensaries. And in the actual law, it talks about this money is only kicked back to local municipalities for the education of medical marijuana. And it actually states we cannot speak to recreational marijuana. And we do get that question a lot. Obviously, whether it's medical or recreational, we don't want people to be under the influence while driving or pregnant either way. But it speaks very specifically to that. The focus is education and outreach on medical marijuana, and it's very clear on that. So that is why we just focus on that specifically.
Thank you. Any questions from commissioners? Right, have no questions. Thank you again for your presentation. And I think that's it. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters.
Public comments.
Right, are there any public comments in the audience today? Anyone here in attendance? How about on Zoom or on the phone? It looks like there's no public comments.
There's an email.
Oh, there is an email. We do have an email. All right.
It says, greetings. I am Mark Ashley Price, a school board member of Highland Park. I don't know if this is appropriate for this committee, but I was wondering if it is possible for the county to help Highland Park to get a new high school and fix the city's library. Much love and many blessings to everyone.
Any other public comments? All right, next item, please.
Adjournment.